United Way's mental health suicide prevention line, Call2Talk, just experienced a major milestone, as we've heard, 5 years of service, which is a pretty amazing thing. And while it is, you could say, a little bit unfortunate and sad that mental health lines like Call2Talk are even necessary, statistics prove that resources like Call2Talk and text lines have a positive impact on those who reach out for help. In their very first month of operation, Call2Talk volunteers answered a total of, first month, 5 calls. That's right, 5 calls over the first month of operation. Every month following, the numbers ticked up, and in the years since those very first few quiet shifts, there have been a total of 150,000 calls answered by trained volunteers. There is someone ready to listen 24 hours a day, 7 days a week, 365 days a year. And you could argue that it would be difficult to truly understand what goes on in the exchange between a caller and a call taker, what that is like, this personal, intimate sharing of feelings, or the spectrum of issues that are revealed that are just so wide. They cover a whole range of age and gender and subject matter. What we wanted to try to do for you tonight was to share with you the opportunity to listen in for a few minutes to a presentation of what it's like to make and to answer a call, to demonstrate and for you to see for yourself the strength and the skill of the call taker and the courage, as Kathy alluded to, the courage of the caller to reach out in their moment of crisis, in their moment of critical need, and how the fundamental act of just listening, purely and intently listening without judgment, can be all it takes to support someone in their most dire moment.
To talk, we're here to listen. It sounds like you're really upset. I'm so sorry you're going through this. Do you want to take some deep breaths together? My name is Maggie. Would you like to share your name today?
I don't think I'm ready.
That's okay. May I ask what motivated you to call us tonight?
I'm so overwhelmed. I lost my job, which I love, due to the company layoff. I was just told that my insurance won't cover my medication anymore.
I'm so glad you reached out to us tonight.
I saw the number online. I didn't know who else to call.
Sometimes people who call here are feeling suicidal. Do you feel like everything you're going through is making you feel suicidal tonight?
I've thought about what life would be like without me.
It must be really hard to feel that way.
But I don't think I could go through with it.
What do you think it is that keeps you going?
I'm not sure. I'm so lonely. I have a couple friends and some family out of town, but no one would understand. I feel like I have no one to turn to. I'm so disconnected. But I did have a cousin who died by suicide, and I saw how that impacted my family. I don't think I could let them go through that again.
That must be a lot of weight to carry around. Have you ever felt this way before?
I've had feelings like this before. I used to turn to my ex-best friend, but obviously we aren't friends anymore.
It is so good you called us then. You are such a strong person.
I don't feel strong. I feel weak. I feel lonely. I feel like I'm not going to make it this time. How am I going to find work? How am I going to get my meds? I have no money and no income. I need my medication to function. How do I do this, Maggie? How do I do this?
What have you done in the past when you felt overwhelmed like this?
Usually I go into bed and wait for it to pass, or I'll snuggle my cat.
Can you snuggle with your cat right now?
I just need to find him.
While you're doing that, can I ask you, is there anything you do when you're not at work to maybe distract yourself from how you're feeling?
I love crosswords and jigsaw puzzles. They keep my brain going.
That sounds like a great idea to keep your mind occupied. Is that something you feel like you're up to doing now?
Maybe, but can you stay with me a little longer?
Of course. We are always here to support you.
I found my cat. My cat's like my child. Who would take care of him if I were gone?
That's a really good point. He would really miss you.
I guess you're right.
When you have those overwhelming emotions, do you think by snuggling your cat, it would help you to remember your life matters to those around you?
It's definitely a start. I would never do anything to hurt him.
That is great to hear. I know at the beginning of the call you were feeling really overwhelmed and anxious. How are you feeling now?
Well, my problems aren't gone. And I'm still anxious about everything. But I'm definitely more calm and I'm feeling a little less overwhelmed.
I am so happy to hear that. Please remember we are here all the time.
Thank you, Maggie. Thank you so much.
Feel free to call back anytime, and we are always here to listen, okay?
Yes, please help me in thanking the Call2Talk staff person and the volunteer who created and enacted our vignette tonight. Our caller, Amy Davis, and our call taker, Call2Talk staff from Maggie McNeil. Thank you both for allowing us a glimpse into your world.